If you wake up with your tongue stuck to the roof of your mouth, your lips feeling unusually dry, and the strange sense that 8 hours of sleep did almost nothing for you, pay attention. A dry mouth in the morning does not automatically mean that you have a serious disease. Sometimes the explanation is as simple as sleeping with your mouth open, having a blocked nose, taking a medication that reduces saliva, or not drinking enough fluid during the day. But when this happens repeatedly and appears alongside other changes, it may be part of a pattern that deserves a closer look. Perhaps you have also started waking up several times to use the bathroom. Maybe you feel exhausted in the middle of the afternoon, even after what seemed like a full night of sleep. You may wake with a heavy head, notice an unusual taste in your mouth, or experience tingling in your hands or feet. Each symptom can have several possible explanations. However, the combination may point toward a problem involving your breathing during sleep, your medication, your oral health, your blood sugar, or the way your body is regulating fluid overnight. The danger is not that every dry morning signals a hidden illness. The danger is assuming that a symptom occurring almost every day must be a harmless consequence of getting older. In this video, I will show you 5 accompanying signs that should not be ignored. We will count them down from the most commonly dismissed to the one that deserves the most careful attention. I will also give you a simple 7-day investigation that can help turn a vague complaint into useful information for your doctor or dentist. My name is Dr. James Carter. For years, I have worked with adults who arrive saying almost the same thing. My test results were normal, so I assumed nothing was wrong. A normal result can certainly be reassuring, but one normal test cannot explain every symptom, and it cannot tell us what is happening to your breathing, your mouth, or your nervous system while you sleep. Consider Eleanor Brooks, a 64-year-old retired school cafeteria manager. Eleanor took pride in looking after herself. She cooked most of her meals at home, stayed active, and always kept a bottle of water nearby. Yet, nearly every morning, she woke with a mouth so dry that she needed water before she could comfortably speak. She initially blamed the air in her bedroom. Then, she blamed her age. Several months later, other changes appeared. She began waking 2 or 3 times a night to urinate. Her husband mentioned that her snoring had become louder. She felt mentally foggy in the morning and needed coffee just to feel functional. Still, Eleanor did not think these symptoms were connected. Her previous blood tests had not shown diabetes, and no one had asked detailed questions about her sleep, medications, or oral health. She therefore assumed that nothing important was happening. But when her symptoms were examined together, a different picture emerged. One of Eleanor's medications could reduce saliva. Nasal congestion was making her breathe through her mouth at night, and her sleep history raised enough concern for her doctor to investigate a possible breathing disorder. Her blood sugar also needed continued monitoring because of her family history and nighttime urination. There was no single dramatic diagnosis explaining everything. Several smaller factors were overlapping and making each other worse. That distinction matters. Morning dry mouth is not a diagnosis. It is a clue, and clues only become useful when we look at the pattern around them. To understand what that pattern may be telling you, we first need to examine what saliva is quietly doing for your body throughout the night. Most people think of saliva as nothing more than moisture. In reality, it is part of your mouth's protective system. Saliva helps you chew, swallow, speak, and taste food. It also washes away food particles, helps control acid, and protects the tissues of your mouth. When saliva remains too low for too long, the result may be more than temporary discomfort. You may develop cracked lips, persistent bad breath, a burning tongue, difficulty swallowing dry foods, mouth sores, new cavities, or repeated oral infections. This is why chronic dry mouth should not automatically be accepted as a normal part of aging. Age itself is usually not the entire explanation. What often changes with age is the number of medications a person takes and the likelihood of developing conditions that affect hydration, breathing, or saliva production. Blood pressure medicines, antihistamines, decongestants, antidepressants, anxiety medicines, diuretics, and several other drugs may contribute to dry mouth. That does not mean you should stop any medication. It means that your doctor or pharmacist should review what you take, when you take it, and when your symptoms began. Other common causes include dehydration, alcohol, tobacco, nasal congestion, and sleeping with the mouth open. However, certain accompanying signs make the situation more important to investigate. Let us begin with number 5. The fifth sign is waking more than once during the night to urinate. Many people assume this is simply part of getting older. In men, it is often blamed immediately on the prostate. In women, it may be attributed to the bladder. Those are possible explanations, but they are not the only ones. Nighttime urination may be affected by the amount and timing of the fluid you drink. Alcohol, caffeine, diuretic medication, bladder conditions, prostate enlargement, high blood sugar, and sleep disorders. Obstructive sleep apnea can also be associated with frequent nighttime urination. When breathing is repeatedly disrupted, sleep becomes fragmented, even if you do not remember waking for every interruption. Pay particular attention when nighttime urination occurs alongside intense thirst, unexplained weight loss, blurred vision, unusual fatigue, or frequent urination during the day. That combination deserves a conversation with a healthcare professional about blood sugar and other possible causes. Do not respond by severely restricting water. Dehydrating yourself may worsen dry mouth and can create other problems. Instead, record how often you wake, what you drank during the evening, and whether the urge to urinate also occurs throughout the day. The fourth sign is a severe energy crash between approximately 2 and 4 in the afternoon. A mild drop in alertness after lunch is common, but needing coffee, sweets, or a nap almost every day just to remain functional is different, especially when you believed you had slept for 7 or 8 hours. Several mechanisms can produce this pattern. A lunch dominated by refined carbohydrates may cause a rapid rise and fall in blood glucose. Poor quality sleep may leave you with too little energy reserve for the afternoon. Dehydration, medication effects, anemia, thyroid problems, and other health conditions can also contribute. This is why the timing matters. For the next 3 days, note what you eat for lunch and how you feel 90 to 120 minutes later. Record whether the fatigue is accompanied by shakiness, sweating, hunger, irritability, dizziness, or a strong craving for sugar. This record cannot diagnose a blood sugar disorder, but it can reveal a repeatable pattern that is much more useful than simply telling your doctor, "I feel tired sometimes." Eleanor noticed that her worst afternoon crashes followed nights when she woke several times and mornings when her mouth was driest. The problem was not a lack of motivation. Her sleep was failing to restore her properly. And that brings us to the third sign, because waking with a dry mouth and a heavy or painful head may reveal something important about the way you are breathing during the night. The third sign is waking with a heavy head or a morning headache. Occasional headaches may result from many things, including stress, muscle tension, dehydration, or poor sleeping posture. But when a morning headache repeatedly appears alongside dry mouth, loud snoring, and daytime exhaustion, your breathing during sleep deserves closer attention. Think of sleep as a nightly repair period. For that repair to happen properly, your brain needs stable breathing and uninterrupted progression through the different stages of sleep. With obstructive sleep apnea, the airway repeatedly narrows or closes. Breathing may become shallow or stop briefly before the brain forces the body to reopen the airway. This can happen many times during the night without producing a complete awakening that you remember. You may believe you slept for 8 hours, yet your brain and body may have been repeatedly pulled out of restorative sleep. Some people wake gasping or choking, but many do not. Their clues may be much less dramatic: a dry mouth, a morning headache, irritability, difficulty concentrating, frequent nighttime urination, or overwhelming sleepiness during the day. Women may be especially likely to describe fatigue, insomnia, headaches, or mood changes instead of the classic image of very loud snoring. If someone sleeps beside you, ask whether you snore, make choking sounds, or appear to stop breathing. If you live alone, consider whether you wake suddenly with a racing heart, notice an unusually dry throat, or regularly feel unrefreshed despite allowing enough time for sleep. A phone recording or sleep tracking device may notice snoring, but it cannot confirm or exclude sleep apnea. A proper assessment may require a home sleep apnea test or an overnight sleep study recommended by a qualified healthcare professional. This was the turning point for Eleanor. Her husband had noticed pauses between periods of snoring, but assumed she was simply sleeping deeply. Once he understood what to observe, he described repeated moments of silence followed by a sudden snort and a deep breath. That information gave Eleanor's doctor a reason to investigate her sleep, rather than treating her morning fatigue with more caffeine. Now let us move to the second sign: waking with a persistent bitter, sour, or metallic taste. This symptom is often blamed on the liver or described online as proof that the body is releasing toxins. That conclusion is far too simple. A strange taste can have several possible causes. Dry mouth itself can change the way food and saliva taste. Acid reflux may allow stomach contents to travel upward during the night, leaving a sour or bitter sensation in the morning. Gum disease, tooth decay, oral infections, nasal drainage, vitamins, and certain medications may also alter taste. The details around the symptom can help narrow the possibilities. A bitter taste accompanied by heartburn, hoarseness, coughing at night, or a sensation of fluid rising into the throat may suggest reflux. White patches, soreness, or burning inside the mouth may point toward an oral infection. Bleeding gums or tooth sensitivity may indicate that a dental examination is needed. If the taste began shortly after starting a medicine or supplement, write down the timing and discuss it with a doctor or pharmacist. Do not discontinue a prescription on your own. A strange taste by itself does not diagnose liver disease, diabetes, or any other specific condition. But if it persists for several weeks or appears with difficulty swallowing, mouth sores, unexplained weight loss, or severe pain, it should be evaluated. The final sign does not begin in the mouth. It begins as a faint sensation in the hands or feet, and understanding the difference between harmless temporary numbness and a recurring nerve problem is extremely important. The first and most concerning sign is recurring tingling, burning, or numbness in the hands or feet. Almost everyone has experienced a hand or foot falling asleep after remaining in an awkward position. In that situation, the sensation usually disappears soon after you move and restore pressure to the area. A pattern that returns regularly, affects both feet, lasts longer, or gradually becomes more noticeable is different. It does not prove that you have diabetes or permanent nerve damage, but it deserves proper evaluation. Peripheral nerves carry information between the brain, spinal cord, and the rest of the body. When those nerves are irritated, compressed, or damaged, the message may feel like pins and needles, burning, reduced sensation, or an electric shock. Blood sugar problems are one possible cause, but they are not the only cause. Recurring numbness may be associated with vitamin B12 deficiency, thyroid disease, alcohol use, certain medications, nerve compression, carpal tunnel syndrome, spinal problems, kidney disease, or other forms of peripheral neuropathy. The location and timing offer important clues. Tingling mainly in the thumb, index finger, and middle finger may be different from numbness beginning in both feet. Symptoms that appear only after sleeping on one arm may have a different explanation from burning that continues during the day. Write down where the sensation occurs, whether it affects one side or both sides, how long it lasts, and whether you have noticed weakness, balance problems, or reduced sensitivity to temperature. You should arrange a medical assessment if the symptoms keep returning, spread gradually, or interfere with walking and ordinary activities. Seek urgent medical help if numbness or weakness begins suddenly, especially on one side of the body, or if it is accompanied by facial drooping, difficulty speaking, confusion, loss of balance, or an unusually severe headache. Those symptoms may indicate a neurological emergency and should never be watched at home. Also pay attention to injuries on your feet. Reduced sensation can make a cut, blister, or burn easier to miss. A wound that is infected, changing color, or failing to heal requires professional care. When Eleanor was asked about nerve symptoms, she remembered occasional tingling in her right hand. However, it occurred mainly after sleeping with her wrist bent and did not affect her feet. Her examination suggested that this symptom needed to be considered separately rather than automatically blamed on her blood sugar. That is an important lesson. Several symptoms appearing at the same time do not always come from one hidden disease. Eleanor's dry mouth was being influenced by medication and mouth breathing. Her nighttime awakenings and morning exhaustion raised concern about disrupted breathing during sleep. Her family history made blood sugar monitoring sensible, but no responsible clinician would diagnose diabetes from dry mouth alone. The purpose of these 5 signs is not to make you afraid of every sensation in your body. It is to help you recognize a pattern and know which questions to ask. If you have identified 2 or more of these signs, write your age and the number of signs you recognize in the comments. For example, you might write 68 and 3. Do not share private medical details. Next, we need to move from observation to investigation. I will show you how a doctor or dentist may separate medication-related dry mouth from sleep problems, oral disease, blood sugar changes, and other medical causes without relying on guesswork or unnecessary testing. The first step in investigating persistent dry mouth is not ordering every possible blood test. It is building a clear picture of when the symptoms started and what may be influencing it. Begin with your medications. Make a complete list of everything you take, including prescription medicines, over-the-counter products, vitamins, and herbal supplements. Write down the dose, the time you take each one, and whether anything changed shortly before the dryness began. Medicines used for blood pressure, allergies, depression, anxiety, pain, bladder control, and sleep can reduce saliva in some people. Diuretics may also affect fluid balance and nighttime urination. Never stop a prescription without medical advice. A doctor or pharmacist may be able to adjust the dose, change the timing, or consider an alternative, but that decision must account for the condition the medicine is treating. The second step is an oral examination. A dentist can look for clues that may not be visible to you, including reduced saliva, new cavities, gum inflammation, fungal infection, and irritation of the tongue or other oral tissues. Mention whether you struggle to swallow crackers, bread, or other dry foods without water. Also, report burning, mouth sores, persistent bad breath, changes in taste, or difficulty wearing dentures. These details help determine whether you are experiencing true reduction in saliva rather than only a temporary sensation of dryness. The third step is evaluating your sleep. Tell your healthcare professional if you snore loudly, wake gasping, experience morning headaches, or remain tired despite spending enough time in bed. Mention witnessed pauses in breathing and the number of times you wake to urinate. Depending on your symptoms and risk factors, a clinician may recommend an overnight sleep study or a home sleep apnea test. These tests examine breathing patterns and oxygen levels. They provide far more useful information than trying to judge sleep quality by the number of hours shown on a clock. The fourth step is considering blood sugar and other medical causes. If dry mouth occurs with increased thirst, frequent urination, blurred vision, unexplained weight change, or unusual fatigue, your doctor may check fasting glucose and hemoglobin A1C. Additional testing should be selected according to your symptoms, medical history, and examination rather than copied from a list online. One result should never be interpreted in isolation. Glucose levels can vary, and symptoms such as fatigue or tingling may have many explanations. Finally, mention symptoms that appear unrelated to your mouth. Dry, irritated eyes, joint discomfort, swelling near the jaw, or difficulty swallowing may lead a doctor to consider an autoimmune condition affecting the salivary glands. A history of radiation treatment to the head or neck is also important because it can reduce saliva production. Eleanor brought her medication list, symptom notes, and her husband's observations to her appointment. This changed the conversation. Instead of saying only, "My mouth feels dry," she could explain when it happened, how often she woke, and which symptoms appeared together. Her doctor reviewed a medication that could contribute to dryness, examined her metabolic risk factors, and arranged an assessment of her sleep. Her dentist also found early oral irritation that required attention but no serious infection. The process was not dramatic, and it did not produce one magical explanation. It produced something more useful, a plan based on evidence. You can begin collecting that evidence before your next appointment. The following 7-day investigation is designed to reveal patterns without asking you to diagnose yourself or make unsafe changes. For the next 7 days, keep a simple record on your phone or a sheet of paper. This is not a treatment challenge, and it cannot confirm a diagnosis. Its purpose is to show when the dryness occurs, what accompanies it, and which factors may be contributing. On day 1, measure the symptom. Before drinking water in the morning, rate your dry mouth from 0 to 10. 0 means your mouth feels normal. 10 means the dryness makes speaking or swallowing difficult. Record the time you went to bed, the time you woke, and how rested you feel. Repeat this rating every morning for the rest of the week. On day 2, track nighttime awakenings. Write down how many times you woke to urinate, drink water, cough, or change position. In the morning, note whether you had a headache, sore throat, or unusually dark urine. These observations cannot identify the cause by themselves. but they help reveal whether the problem is isolated or part of a nighttime pattern. On day 3, review your medicines and supplements. Record what you take and when you take it. Mark any medicine that was added or adjusted near the time your symptoms began. Do not skip or alter a dose. Bring the completed list to your doctor or pharmacist for review. On day 4, examine the hours before bed. Record the timing of your final meal and any evening alcohol, caffeine, or sugary drinks. Note whether you were congested and whether the room felt unusually dry. If you regularly eat immediately before sleeping, try finishing dinner approximately 3 hours before bed when practical. This may reduce nighttime reflux in some people, but it is not a substitute for treatment when reflux is persistent or severe. On day 5, check your mouth carefully in good light. Look for cracked lips, redness, sores, white patches, gum bleeding, or a tongue that appears unusually irritated. Notice whether you need water to swallow dry food. Do not scrape, burn, or apply harsh home remedies to any abnormal area. A sore, lump, or patch that persists should be assessed by a dentist or doctor. On day 6, focus on safe supportive habits. Drink fluids regularly throughout the day instead of consuming a large amount immediately before bed. Avoid becoming dehydrated, especially in hot weather or after exercise. Limit alcohol and tobacco, both of which can worsen oral dryness. If you use mouthwash, check whether it contains alcohol. Sugar-free gum or lozenges may stimulate saliva for some people, although they may not be appropriate for everyone. A short walk after dinner may support sleep and metabolic health if you can exercise safely. Choose the whole fruit more often than juice, especially if blood sugar is a concern. On day 7, organize what you discovered. Circle the mornings with the highest dryness scores. Look for connections with medication timing, congestion, late meals, snoring, repeated urination, headaches, or afternoon exhaustion. Create a short summary containing 5 things: when the symptom began, how often it occurs, your average dryness score, the accompanying signs, and your complete medication list. That single page can make a medical or dental appointment far more productive. Do not expect every symptom to disappear within 7 days. Success means replacing uncertainty with a pattern that can be evaluated. In the final part, I will show you how to protect your mouth while the cause is being investigated, which symptoms require a routine appointment, and which warning signs should never be postponed. While the cause of your dry mouth is being investigated, there are practical ways to protect your mouth and reduce discomfort. Start by drinking water regularly throughout the day. Taking small amounts at intervals is usually more helpful than waiting until bedtime and drinking several large glasses at once. However, people with heart or kidney conditions may have specific fluid restrictions and should follow the advice of their healthcare team. Good oral care becomes especially important when saliva is reduced. Brush gently twice a day with fluoride toothpaste and clean between your teeth daily. Regular dental examinations can identify early decay, gum disease, and oral infections before they become painful. Sugar-free gum or lozenges may stimulate saliva in some people. A dentist or doctor may also recommend a moisturizing oral gel, spray, or saliva substitute. Check before using these products if you have difficulty swallowing or another condition that could make chewing gum or sucking lozenges unsafe. Avoid using sweets to keep your mouth moist. Frequent exposure to sugar can increase the risk of tooth decay, particularly when there is not enough saliva to protect the teeth. Alcohol, tobacco, and mouthwash containing alcohol may worsen dryness or irritation. Excessive caffeine may also contribute in some people, especially when it interferes with sleep or replaces water throughout the day. If nasal congestion is forcing you to sleep with your mouth open, discuss the cause with a healthcare professional. Do not rely on decongestant sprays for extended periods unless specifically instructed, because some can make congestion worse when overused. A bedroom humidifier may provide comfort when the air is very dry, but it should be cleaned regularly to prevent mold and microorganisms from building up. It may reduce the symptom without correcting the underlying cause, so persistent dryness should still be evaluated. Arrange a routine medical or dental appointment if the problem occurs most mornings for several weeks, interferes with speaking or swallowing, or is accompanied by new cavities, bleeding gums, mouth sores, persistent bad breath, or changes in taste. You should also seek an evaluation if dry mouth appears with excessive thirst, frequent urination, unexplained weight loss, repeated morning headaches, loud snoring, witnessed pauses in breathing or recurring numbness in your hands or feet. Some situations require faster attention. Contact a healthcare professional promptly if you cannot swallow normally, develop swelling around the jaw or neck, notice a mouth sore or patch that does not heal, or have signs of infection such as worsening pain, fever, or spreading redness. Seek emergency help for sudden weakness or numbness on one side of the body, facial drooping, difficulty speaking, severe breathing difficulty, fainting, or sudden confusion. Those symptoms should never be explained away as dehydration, poor sleep, or aging. For Eleanor, improvement did not come from a detox drink or a miracle supplement. Her clinician reviewed the timing of a medicine that was contributing to dryness. She received help for chronic nasal congestion, and her sleep assessment confirmed that her nighttime breathing needed treatment. Her dentist helped her protect her teeth and irritated oral tissues while those issues were addressed. Eleanor also began recording her sleep, nighttime urination, and energy levels. Gradually, her mornings became easier, and she stopped depending on repeated cups of coffee to push through the day. Most importantly, she no longer treated each symptom as a separate inconvenience. That is the central lesson of this video. A dry mouth in the morning does not prove that you have diabetes, sleep apnea, nerve damage, or another serious disease. But when it keeps returning, especially alongside other changes, it is worth asking why. Your body is not betraying you, and you do not need to panic over every uncomfortable morning. You need to notice what persists, connect the clues, and bring useful information to someone qualified to evaluate them. Begin with the 7-day record. Review your medicines with a doctor or pharmacist. Protect your oral health, and do not ignore changes in your breathing, thirst, urination, or sensation. If this video helped you understand what your mornings may be revealing, share it with someone over 50 who has been dismissing these symptoms as a normal part of aging. In the comments, write your age and how many of the 5 accompanying signs you recognized, from 0 to 5. Please do not include private medical information. I am Dr. James Carter. Listen carefully to the patterns your body repeats, because recognizing the right clue today may help you prevent a much more difficult problem tomorrow.